Slowly. What is going on, you guys? Andrew Gomez checking in. I just wanted to announce that we're finally done with clinical rotations, you guys. I feel like I haven't been talking with you guys that much for the past couple days. Even though for these past couple days I've been real busy with school and work, especially with finals coming up, 3 proctored ATIs are coming up. I decided to take this time of the week, this day of the week, to share with you guys my experiences with clinical rotations over the past couple of years. Alright, you guys, it's Friday. It's currently 9 in the morning right now. Yesterday, unfortunately, I was called in for work. I wasn't able to continue sharing my experiences. I was actually in the process of recording them, but then my work called me in, so I had to go to work from 5 to 11 p.m. But when I was over there at work, I was listing down my experiences on a piece of paper, so that later when I'll be telling them with you guys, or when I'll be sharing them with you guys, I won't be having a brain fart or have to take a pause and think about it. So yeah, I'm gonna go get my blood work done. The place is like 5 minutes away anyway, so yeah, I'll see you guys in a bit. Okay, so even though I got called in for work yesterday, it was pretty worth it, because we had a meeting, I really had to go, and then we also had a taco truck. It was unlimited tacos. I got myself a big old burrito and a couple quesadillas. I'm super full from yesterday. Anyway, so let's proceed to my story time, you guys. So for first rotation for med-surg, we went to Kaiser Permanente, just here locally here in Fresno. It was a pretty good experience. I remember waking up 05 in the morning, coming at 06. Our clinical instructor didn't want us to take the elevator. He would just have us take the stairs, and then it was actually kind of funny. Every time I know that I might be late, I would have my wife drop me off from the entrance, and then I would run, take the stairs, run, and try to catch my breath before I even go close to my group. But yeah, Kaiser, I got to pull up meds from the fixes. I got to administer medications orally or PO, and also got to administer medications through the G-tube. And one of the nurses that I shadowing at that time, he was pretty nice actually, because at first I forgot the step-by-step process of giving medication through the G-tube because I was nervous and I just had a brain fart at that time. I totally forgot, because it's so much different to do it actually on an actual person compared to doing it with just a mannequin or a dummy. So we checked the placement, administered 20 mils of air or 50 mils of air, and we checked the gush of air through the stethoscope, and then I pulled out residual, and luckily it wasn't 100 mils, or it wasn't more than 100 mils, so we were able to administer the medication. And we also checked for bowel sounds, so I did get to administer medication through the G-tube, and also got a chance to DC Foley catheter on 2 male patients at Kaiser rotation. We had one patient that was vomiting a lot. He was having a lot of GI issues. He did not feel well. The physician ordered to do a gastric lavage. Basically how it was, we inserted NG tube nasally, and we were able to suction the GI content, and the patient felt relieved a couple hours later. So I thought that was a pretty good experience. And I also got my first needle stick injury over there, you guys. I was not stupid, I was just nervous because it was my first time actually using the carpet or carpet. I don't know how to say it properly. I just stuck myself randomly. Luckily it was not contaminated. Luckily I haven't administered it yet, and there was no blood or anything. It was clean, it was not contaminated when I stuck myself. So I just had to notify my CR, clinical instructor, Mr. Urgent. I just washed it with soap and water and then wrapped it with a band-aid. So yeah, I would rate my experience with Kaiser 10 out of 10. It was the best. It was the best clinical rotation that I've been to be honest. Okay, next we went to VA hospital, or the Veterans Hospital. We were basically doing a lot of paperwork, a lot of vital signs. I was able to insert full cap on 2 male patients over there at the VA, and also got a chance to observe in a herniaplasty surgery on the hernia on one of the patients. Yeah, it was a pretty good experience. I got a chance to observe a lot of things in VA. It's just that I didn't get a lot of hands-on experience compared to the hands-on experience that I got from Kaiser. And I would rate the VA hospital experience about 7.5 out of 10, really. Okay, next let's proceed to the respiratory rotation that we went to. We went to Horizon. We did a lot of trach here. We cleaned the trach ties. I was able to replace the inner cannula with a supervision of my clinical instructor. We did a lot of G-tube here. We did a lot of administration of medication through the G-tube. You know, at that time I was already expert with putting the medications in a G-tube. I was able to, you know, check my placement, administer 50 mils of air to check the gush of sound, the gush of air through the stethoscope. I was able to check the bowel sounds and check the residual. If it's not more than 100 mils, I was able to administer it anyway. And we did a lot of wound dress change on Horizon, and then we did a lot of computer charting. Computer charting, like, you know, from head to toe review systems, like for the GI, respiratory. We also did a lot of CNA work, you guys. Like, we gave a bath to a couple of patients, and it's just that I felt bad because every time we had to clean them off for the bottom, you know, when they go number 2, they didn't have any wipes over there. We just had to use washcloths, and I don't think it's sanitary doing it like that. Even though we had soap and water, I think it's still best to, you know, wipe them with wipes to properly clean their bottom. It's just that I felt bad for the patients. And we also did a lot of trach suctioning. I was able to trach suction once or twice. I think only one time. Oh no, twice. I was able to do a trach suction on a patient twice. So for the Horizon rotation experience, I would rate that about 10 out of 10 still, you know. Because we did a lot of hands-on experience. I'm all about doing hands-on work compared to just studying. You know, I'm that kind of guy who would rather do it actually compared to just learning it. I mean, it's necessary to learn the process, but for me, I love it. I have fun doing it when it comes to hands-on experiences. Okay, last but not the least, on one of my best ever experience or best ever clinical rotation experience was over there at Ridley for my maternity rotation. We did a lot of postpartum care. We did a lot of infant bed baths. I was able to administer vitamin K shot and Hepa B shot on the legs of the babies. They were so cute. They were so little. They were only like 6, 7, 8, 9 pounds, and there were some couple, you know, 10 pounds. But I would say the highlight for that rotation was I was able to observe cesarean delivery. And for me, seeing that baby coming out of the mom, I thought to myself, wow, that is another life coming out of someone else's life. I don't know if that makes sense, but I hope it does. So yeah, I would say the top 3 rotation experience that I went to would be Kaiser for med-surg, Horizon for respiratory, and Ridley for maternity. Of course, we went to different rotations as well for pediatrics. You know, I played with a lot of kids. We did a lot of head-to-toe assessments and all that good stuff. And we also went to Madura Community Hospital, and I would say the best highlight for that rotation was the ER because there was so much action going on, and I like it like that. I like it busy, I like it fast, I like to make decisions quickly, and the time flew real fast as well. And I even considered about working over there when I get my license, so I think that should be pretty cool. So thank you so much for watching this video, guys. I know it's a little longer as usual. My biggest takeaway message for you guys is be a sponge, especially if you're a beginner, especially if you're barely starting with your nursing program. It doesn't matter if you're only going through an LVN school or an RN school. Don't be that kind of student who knows it all, or be like, I already know that, I don't have to listen to you, I don't have to pay attention. Just be a sponge and observe the information because it's not gonna hurt you, it's only gonna help you out in the long run anyway. So yeah, this is gonna conclude today's vlog, you guys. Thank you so much again for watching. Remember, always keep your feet on the ground, eyes on the sky, stay on the grind all the time, you guys. I'll see you guys in the next one.